Okay, so why fertility control can be important for animal and also human health? And also, what could be possible application of this? Myself and Manel, we will try to address to this question in 15 minutes, 7 for each. And and we will also show some of the work that Manel do in the city of Barcelona in practice. So the first concept that we will focus is One Health. It's something that is very common and in which very easy to understand, in which human, animal, and environmental health is strictly connected. This is something that now is becoming popular, but this is a concept that starts from 2000. And it's very interesting because normally physicians speaks about, with a physician about human problems and veterinarian with veterinarians, but we are understanding that a global approach, an integrated approach is winning, and it's also something that is required for example, European Union calls for applying research or control projects. So we have to think that every species, from humans to animals, have their own pathogens, so virus, bacteria, parasites. And we normally manage this, nature manages this in a very easy way and normal way. During millions, we have adapted to them. But so we live in equilibrium with them. So, but what happens is if this equilibrium is broken? And that sometimes this equilibrium can be broken by humans. For example, with fragmentation of habitats, but also with climate change. If this equilibrium is broken, some problems can arise. In terms, for example, of concentration of animals, that is not anyway, is always a problem because it can favor the diffusion of disease. Of course, I've talking about environment, because One Health includes also environment. And in this moment, most of the scientists, of veterinarians, also ecologists that works on models on vector-borne disease that are disease transmitted by insects, that means mosquitoes, sandflies, but also ticks, are explaining that we are living in a period in which every year we found new species coming north or south, because their ecosystem, their environment have been changed. For example, in some region of Africa, they are too hot and they are going north. So they are going in Europe, they are going in UK. So our mission to be ready to focus these problems. And for example, the recent claims in newspaper of malaria case in London, but also in my country, in Rome, but also in Sardinia, we have several cases of dengue. We are vaccinating against dengue in humans, are all signals that things are changing. And we are predicting this phenomenon more and more. So we have to be ready. And this, in this, for sure, which are, sorry, I forget to slide the show. And within this, we have some old and new solution. Fertility control can be a solution, we will see how, but I just skip this, slide just to focus on one important concept as veterinarian, as people that work with animals. That cannot be considered a possibility, the poisoning of animals. Why? Because it is something which is a silent killer, doesn't discriminate animals. So we have a talk today about rodents and the control of rodents. It could be okay, but these rodents are part of the ecosystem, are often eaten by other animals, by scavengers. And so just to show you, in Sardinia, in the country where I come from, most of vultures have been extincted, also by poisoning, because it is indiscriminate. And also, it's a very, very long death. It can raise up to 1 or 2 days of inhuman suffering. So it could be a solution. And on this, I just cite this article because it can be acceptable in Europe, but I think in all the world. And also, fertility control can be a solution. What are possible problems that can be focused with fertility control, in which fertility control can help? For sure, we have this problem that we talk about foxes also with the colleague that speaks about rights of foxes. Yes, it's true. And in some region of Europe, foxes can be a problem also of vehicles of very important zoonosis to humans. And of course, the control of the population, especially in cities like Zurich, where foxes are like dogs, are very popular, but also in Canada is the same, can be a useful tool. But also can be interesting also in Southern Europe, where cystic echinococcosis, another parasite, which is a similar life cycle, but have stray dogs and shepherd dogs as a host, can be controlled because other way of control usually fails. So I will give the floor to Manel, that will explain also how this fertility control can be used in a urban setting, the setting of Barcelona, a very big city, with a One Health approach, also considering the animal welfare. Please, Manel.
Thank you. Good afternoon, thank you. So, second part of the talk. So, let us show you the results of a project that we started 6 years ago, assessing the efficiency of gonacon in wild boars inhabiting an urban park, natural park, very close to Barcelona. So the issue of increasing numbers in wild boars and swine, and feral swine, it's an issue worldwide, so this is nothing new. But in case of urban areas, so we find several populations coming to the urban areas mainly to look for food, high energetic food usually, and water, and also looking for a reduction in hunting pressure at these urban areas. As well, the urbanization of the cities is usually getting natural areas, so that we are going to invade in some way areas inhabited by wild boars. So as Giovanna mentioned this morning, so we are killing more and more animals, wild boars, everywhere in the world. But the number of conflicts is as well increasing, mainly at the urban areas, car accidents, aggressions, and as well risk for maintaining the local biodiversity. We started this project in a holistic approach, so bringing fertility control with gonacon to the animals, to the wild boars, but as well paying attention to try to limit the access to food and water at the urban areas, and as well to increase public awareness of really we don't need to feed these animals because we are not doing something good for them if we are bringing them to the cities. So this is a collaboration with Giovanna and the National Wildlife Research Center, and 4 different villages very close to Barcelona collaborating in this project. So we captured around 300 animals. We injected gonacon. We had as well control animals. And the main results of this project was a reduction in conflicts and improvement in car accident rates at the different places that we were working on, and mainly in the places that the vaccination program was intense. From the physiological point of view, from the animal point of view, the main result was that it was effective mainly in females, and more importantly in young females, when the vaccination, when the contraception was administered around peripubertal age. So the effect of the contraception could be permanent when it's administered in the animals at this age. So we confirmed that with domestic sows, domestic pigs. Sorry for the pictures, but it's easy to see that at the right side of the slide, you see the genital organs of a female contracepted when she was at the prepubertal age 1 year later. And at the right side of the slide, a control female. So the key is for the contraception to be permanent, the effect to be permanent. The key action is to avoid the stimulation of the GnRH to the genital organs at the moment that they need to grow, when puberty is around. So the uterus and the ovaries are immature, although the age of the animal is enough mature to show reproduction. And as well, when we go for histology, we see that there are no endometrial glands that are needed for implantation and to keep any pregnancy. So, talking or meeting our government administrators, the only approach that they would be accepting to apply in this urban park would be a combined approach. With considering those results about the potential permanent effect over prepubertal females, so they would be accepting to move forward, if we find the budget that we need for that, they would accept to administer fertility control contraception to prepubertal females and cooling with different strategies, the animals at different ages, with the expected outcome of getting a gradual reduction in the need of cooling in around 5-6 years. So all females at prepubertal age administer with contraception, and that brings this outcome. So fertility control, as we are discussing here in this room during today, so it can be an effective strategy for managing overpopulation, but as well, as Antonio was mentioning, it's as well a very valuable method to reduce the risk of zoonotic disease transmission, and as well to other diseases like African swine fever in the case of wild boar. Why, inside of this concept of One Health, why fertility control is bringing this approach? So inhibiting reproduction reduces nutritional needs of the animals. So there is a lower nutritional requirements and less access to the cities, to the urban areas, to look for food and water of these animals. As well, if there is no reproduction, there is a decreased contact between animals. So the frequency of interactions between animals is minimum, less than control animals. As well, they are occupying less amount of space. So the distribution of the animals in a natural park like this one that we were working close to Barcelona is reduced. All these factors contribute to a reduced risk of disease spread, including zoonosis or African swine fever, as we mentioned before. And it's the way that fertility control can bring broad implications for public health, animal welfare, and environmental sustainability. So, because urban wildlife like rodents and wild boars could be a risk for zoonotic transmission because of the close contact with human communities, with waste, food coming from humans, so we check if wild boars and rodents from these areas could be a risk for transmission of COVID in the time of the pandemic. So we check the presence of the virus in these animals, in samples of these animals, so nasal swab samples, and no animals tested positive. When we look for antibodies against COVID, so we found 3 wild boars positive for COVID. But these animals were false positive because we confirmed that with the virus neutralizing test. So we can say that in this case, wild boar and rodents didn't exhibit signs of exposure or acute infection for COVID. However, so samples from these animals, fecal samples from these animals, are showing the presence of several bacteria resistant to antibodies. For instance, penicillin, cephalosporin, and more importantly, some of the bacteria that we find in these animals are resistant to last resort antibiotics used for multi-drug resistant infections. So this is bringing a concern about antibiotic resistance in humans, for instance. Talking about welfare stress, so we compare the glucocorticoid levels of animals, wild boars, inhabiting urban areas and at the north of Spain, close to Barcelona, and in natural areas with seasonal hunting, but low presence of humans at the south of Spain. So the levels of glucocorticoids in animals inhabiting urban areas were 5 times higher than animals in a place where they are hunted, but the presence of human activity is low. So this is important, but the most important thing is that animals under chronic stress are more susceptible to diseases because there is an immune suppression coming from the high levels of glucocorticoids. So, and this is increasing the risk of zoonotic transmission from these animals. To finish the talk, so fertility control in a holistic approach can be helping to manage urban wild boar populations, but as well it provides a valuable measure for mitigating the risk of zoonotic disease transmission in a One Health approach. So thank you very much.